This short video is on umbilical hernia or the belly button hernia. As you can see over here, these are very common worldwide. They tend to start off with small lumps and then they grow bigger in size. The symptoms are same as any other hernia. Starts off as a lump and it just gets bigger, starts causing pain such as dragging, burning type pain, maybe stabbing type pain. It can get quite troublesome, and sometimes even small hernias get quite troublesome when there's something trapped inside of them. The diagnosis is pretty obvious because of its physical appearance, and a doctor examining you should be able to diagnose it. Rarely an ultrasound scan is required. So once you've had it diagnosed and it's not causing any symptoms, is it okay to watch it? Yes, it's okay to watch it, but not to let it get too big, because then it becomes the repair becomes a little bit more complicated. The actual defect here is a cartoon representation of this. So this is the belly button, and this is the defect through which the hernia is formed, and this is the outside of the hernia. The defect usually is smaller than what you can see over here, because whatever is inside, such as fat, etc., has come out. Okay, so how do we repair a hernia? So it is a surgical operation, and if the hernia is small, then the open repair is quite reasonable. All you do is you put some stitches in the hernia and bring it together, and that's how you treat it. This would work well for something that is 2 centimeters or about 1 inch in size, where a suture repair is performed. For bigger defects, the use of a mesh, which is a piece of artificial material which is placed beneath the hernia. Ideally, it can also be placed within or on top, but the ideal location is beneath the hernia but above the bowel, and having some protection from the bowel. And the use of the mesh reduces the incidence of recurrence. The hernia itself is repaired with suture and the mesh is secured underneath it, in what I previously described in another video as the sublay technique. So this is with open surgery, where you approach the hernia directly and repair it. Is there any other way of doing so? That's open. Is there any other route of treating it? Of course there is. For bigger hernias or recurrent hernias, or where you're not sure that what the size of the defect is or whether there are other defects, the laparoscopic or keyhole approach could be used. And how does that differ? That means making an initial entry through the side, not directly, sticking a camera inside, having a look all around, identifying the hernia, and then operating with 2 other ports and repairing the hernia from the inside, and then supplementing the repair by use of the mesh, but again all this is done from the inside. So the laparoscopic repair certainly has a place in the repair of this, but for smaller hernias my personal preference is using the open route. Is there any other way? Yes, the most recent entrant is robotic. The true place of robotic repair in this is not clear. However, the principle is exactly the same as the laparoscopic approach. This culminates this short video on belly button hernias.